Hi, my name is Dr. Kaufman. I am the developer of the pain neutralization technique, and what we're going to show you in this short video is how quickly and simply we can turn off trigger points as they occur throughout the muscles anywhere in the body. We're not going to teach you this particular technique right now. I just want to demonstrate to you, and here's what's probably going to happen. We found the trigger point, it's approximately the level of T8 and T9 on the left side in the latissimus muscle. We found the trigger point, and I'm going to use one of our procedures. This particular procedure is called a pain control pattern, but we have many dozens of techniques to turn off trigger points. And in fact, I guarantee you I'll be able to turn this trigger point off by the end of the video. So we found, is that pretty sore in there, Alex?
Oh yeah.
Yeah, that's pretty sore, and actually that particular trigger point is in the latissimus muscle, as I mentioned. So as you can see, I don't want to do this too many times, but you can see the patient flinching. You can see that it's very tender down there. You don't have to. And how's that now?
That's much better.
Much better. How about that way?
Gone.
It's gone. So what I'm doing is I'm just triggering what we call one of our pain control patterns. This is basically a neurological reflex that makes use of the Melzack wall gate theory of pain. It's not my intention. How about now?
Oh, it's all gone.
It's all gone. Yeah, it's not my intention on this particular video to teach you how to do that, but just to demonstrate how quickly it happens. First, we found the trigger point in the muscle, and we have a wide variety of procedures that we can use that will turn the trigger point off. This, by the way, if you don't know this, is a radical understanding of how to apply therapy to trigger point muscles. The vast majority, in fact, every other procedure that I know of that's treating trigger points and treating myofascial dysfunction using trigger points, what they do is they apply some kind of treatment to the trigger point itself. I did not do that. All I did was find the trigger point. I elicited the tenderness and the pain by pressing on the trigger point. And all the reflexes we use in pain neutralization technique, which you can read about at PAINLESSLY.com, all the reflexes we use are away from the trigger point. That particular reflex that we used is actually several feet away from the trigger point itself. There are, as I mentioned, several dozen different ways we could have turned off that trigger point, but I chose that one. The point is that first we had the trigger point, we did the procedure, and then we did not have the trigger point. That's how quickly. It happens within a few seconds. The techniques are very light, they're very gentle. We don't put any kind of mechanical force into the patient. We don't do anything that actually hurts the patient. It's not uncomfortable for the patient. They're very simple procedures, they're very quick, they're very rapid. Usually within 1 or 2 visits or 3 visits, the patient will actually notice symptomatic improvement. Sometimes it's immediate, sometimes it takes a few minutes, but it's very consistent. Obviously not every patient responds. And the techniques are very, very easy on the doctor. There's not a lot of force. You don't see me working up a lot of sweat. So that's kind of what it looks like. And again, our website is PAINNeutralization.com, which I think you should go there immediately. Read the 300 testimonials we have from chiropractors, medical doctors, and acupuncturists, and call me up right away, and let's get you set up with the pain neutralization technique or one of the other courses. Thanks very much for listening.